serve Canada's community e-talk show with our new series, Youth and Mental Health. Last week, during the talk segment, Anu and Dr. Sujoy had an informative discussion on our episode topic, Isolation and Involuntary Solitude. They touched upon the main issues of isolation, how it is connected to mental health disorders, what causes involuntary solitude, and lastly, some methods for viewers at home to use when coping with isolation during the COVID-19 pandemic. This week, for Episode 7, Dr. Sujoy will be looking at our new topic, Newcomers and Immigrants to Canada under a lens, and explain how the process of immigration and settlement can negatively impact mental health. But before we head into the conversation, let's visit Jatin in our news corner.
Hello everyone, this is Jatin and welcome to the news this week. The Government of Canada is addressing and overcoming the unique barriers faced by newcomers, particularly significant for racialized newcomer women, which have increased since the onset of the pandemic and its disproportionate impact on women. The government announced support for 11 innovative projects through the Racialized Newcomer Women Pilot with $2.1 million in federal funding. In other news, a new comprehensive and community-driven report shows that taking a wraparound approach to healthcare for newcomers, including hyperlocal strategies to deal with stigma around diseases, is the best way to ensure people can address their health issues as soon as possible and in comprehensive ways. Moving on, with $96,000 in funding from the City of Calgary's Change Can't Wait initiative, the Healing Centered Cooperative is designing a music and breathwork program to help people facing mental health challenges from the pandemic. The first phase of the project focuses on immigrant and refugee communities. Christine Gibson, a family doctor and the founder of the Healing Centered Cooperative, said that while there is a huge need for mental health supports in general since the pandemic, with high rates of anxiety and stress across the country, these issues are compounded in certain communities. If you want to know more about any of these news articles in depth, head over to our social media feeds and you'll find links to all of these articles. Now let's head into our unscripted talk segment with Anu and a special guest of the week. Thank you.
Thank you, Jatin. That was a great article that you shared with us. I believe that the mental health and well-being of newcomers and immigrants in Canada is a topic that has not been discussed enough yet. Immigration is actually such an integral part of Canada's economy and lifestyle. Almost 8 million of immigrants with permanent residence are living in Canada, which actually makes about 22% of the total Canadian population. However, the past studies show that immigrants generally arrive in Canada with a better mental health than Canadians, but it declines very quickly in a short period of time in Canada. So why is that so? Why is mental health taking such a big toll amongst the newcomers when they reportedly should be overjoyed with moving to such a great multicultural country like Canada? So of course we know that the process of immigration itself can be very stressful, but there could be added stress and other factors like unemployment, separation from family, discrimination, prejudice, language barriers, lack of social support, and many other things. However, we find that the biggest influence on immigrants' mental health is related to family. Without that family support, the social support in their day-to-day lives, the immigrants and the newcomers, they become very, very lonely, and it gets very scary for them to adapt to the changes in their lives, and therefore they're likely to get a high level of stress. So let's define good mental health. So good mental health does not only mean the absence of mental health disorders and problems, but it also means the presence of having very good coping skills like resilience, flexibility, and balance. So it is very, very important that we do not brush off the health concerns of the individuals who are the newcomers and immigrants in our country, because they play a very important role in Canada's population and diversity. So let's call Dr. Sujoy Ray and continue our conversation on this topic. This week's topic is going to be newcomers and immigrants in Canada. And so I'd like to welcome again our psychiatrist, our clinical teacher, and researcher, all in one, Dr. Sujoy Ray. Welcome to the show. And without further ado, let me start with our questions. This is specifically for people that many people don't realize the challenges of immigrating into a new country and how difficult that process can be from a mental health perspective. So I was thinking that it's a little bit off the boundaries, but however, the mental health aspect of it still plays a big role for newcomers and immigrants. So I just wanted to ask you the question that could you explain to our audience why in general immigration or immigrating to a new country can be very stressful?
So, hello and thank you for having me again. So immigration is basically, it's a big change in anybody's life. I mean, you're used to a particular routine, culture, way of living, and when you migrate to a different country, or even, I mean, within the same place, if you migrate within the same country, if you migrate from one job to other, things like that, so that you feel a bit stressed because it's a change in a routine. Any change is always stressful. So it could be a positive change, negative change, even if the new job. Usually people will migrate in search of a better job, better life, something like that. So that way, actually, migration is a planned thing or a positive thing, unless of course you're talking about some sort of displacement and refugees who are going to other countries. But either ways, it even if it's a positive thing, it's a change. So the reason that migrants feel difficult is because of change, whether it's a change in the weather, culture, food, new schedule, new type of job. So any kind of a change is bound to bring stress and problems to a person. And here there are a lot of things changing in one go. So it's not just you're changing your job, you're also changing your living place, you're also changing the culture around you. So this change is the major reason for the stress.
Yeah, no, that is so true. As we had just talked about that earlier, there was a statistics that had come out that most of the people who come or immigrate to the country, obviously they come with a positive mindset and they are willing to make that change, and they come with a good mental health, well-being. But once they go through the change itself, it has seen through the survey that the mental health deteriorates quite a bit. So obviously, like you said, the change and all that plays a big role in that. So like we just said, that immigration is just not the end. Basically, it is the beginning of all the challenges that people might face and adapt to the new things. So I think you already did explain that, but maybe we might just need to go into a little bit more detail. That what are the most difficult things that newcomers might face while settling into the new home, but considering from I guess how they would how it affects their mental health. Like, I mean, which thing that you think that would really impact them the most for the newcomers who come to a new country or migrate?
So we can start with very simple things, like say for example jet lag. If you're migrating to a country which is very far off and in a different time zones, day and night will be different. So you may be accustomed to going to sleep at a particular time, which is actually evening time in the new country, or the other way around, something like that. So that is the basic thing, because sleep-wake cycle is something which a body has really gotten used to for a long period of time. Long time. So that is a simple that is one of the simple things. Then many countries have different daylight periods. Like if you go closer to the pole, the summers, I mean, the daylight in the summers will be very long. In the nights, even till evening and night time, there would be some daylight. And
Right,
in the
right.
other way around, in the winters, you'll have darkness at very early in the afternoon or in the evening itself, which is not the case if you go close to the equator. So you will have more equal, day night sort of a thing. So that these this daylight changes are very difficult. Weather also has an effect on people. So not always, but sometimes cold weather. It could be cold, hot, anything. Weather affects people in not only physically but also mentally. Then there are anxieties because systems in different countries are different. Bank system is different. Financial things are different. The way you get paid is different. Even what how you do basic day to day life things, whether shopping, transport, they are different for different countries. It may be better, it may be worse. Say the transport system may be better, may be worse. It's not about better or worse, but it's a change. You're not used to it. Then managing things in your home country or in your home place, you may have a lot of family support or house help or maids and things like that. When sometimes, no, most of the time actually, when a person comes in first, he has to take care of his own house. Of course, if he's bringing family and all, that is different, but otherwise they have to take care of their own house, whether it's the cleaning, cooking to do. Usually students and these kinds of people who are migrating, they'll do everything themselves. So suddenly you have a lot of responsibility. Time, you have to manage your time according to that, and you have to study or work or whatever it is that you are doing. So you have to manage your time. So these are some of the things which are basic things which you take time to get adjusted. Apart from that, of course, you have a new job, new expectations, simple things like if it's an office work and you don't know the computer system, or if you're not familiar to computer IT systems, you are used to do paperwork, you will take time to get adjusted to them. So these simple things, new colleagues, new boss, those things, you will be anxious that whether these people will like me or not, or whether these people will judge me or not. So those kinds of things, especially in a different country, you may have other issues, discrimination based on race, ethnicity. So you're worried about it, even if you don't face it. Hopefully, thankfully, if the person doesn't face it, but the person is still worried about it. Either ways, so many anxieties are there, and that is why no matter how qualified you are or how accomplished you are, these problems are always there. So that is a major source of anxiety. And unfortunately, if you meet something which is negative, if you meet discrimination and things like that, then people can go into a sort of depression and start having self-doubts.
Right, right, right. So basically, I think in a nutshell, you can say that it's almost like a culture shock. And it does not necessarily mean that just because you're coming from one culture to the other, but it is just a nomenclature where it means like there's so many things that are going to be different and change, which is what you have to kind of deal with. And if you deal with it in a good and a positive way, then of course you are okay. Otherwise, you might start having anxieties and some mental health issues with that. This leads me actually to a third question, which is more that for Canada specifically, that we are kind of blessed to be living in a country which is actually multicultural. And with immigrants coming from all across the globe, and there's almost 21.5% of the population is coming from all around the country, the different from the world. So, what populations do you think are more vulnerable in experiencing this sort of mental health issues when immigrating? What kind of demographics, if I can put it that way, do you think would be more vulnerable to this?
So I would say that elderly people would be vulnerable because they have lived a long time in their home countries, unless of course you're talking about some people who travel frequently. That is a different thing.
Right.
But otherwise, if you're taking elderly people who otherwise stayed in their home country all time throughout, so with age, people tend to get a bit more rigid. It's difficult to adapt to change when you are older. So elderly people would find it difficult. Conversely, again, very young children or very small children may find it difficult, or the anxiety may be more in them. Apart from that, it's not. I mean, people who have mental health illness issues of their own, or physical illnesses also, because again, the medical system in different countries will be different. So how they are getting treated for their medical illnesses or mental illnesses, and even just having a mental illness, even if the treatment is different, not very different, or it's easy to take, still having a mental illness makes you more prone to get stressed if you have a change in the circumstances around you. And again, people who have existing substance use, drug addictions, these kinds of things, they all, I mean, basically, drug addiction is of course also a mental illness. So any kind of mental illness will predispose to people, predispose to stress, I mean. Then people who have faced recent trauma, I mean, they have faced some kind of problems, who have had, or I mean, trauma may be personal, or the experience of moving, who have not had a good experience of moving. Their relocation has been difficult. As I was saying earlier, they have faced some discrimination, or they have faced some issues, whether it is through their, because of their visa, or whether their actual travel, if there have been issues. So if these issues happen, then already there is some negative thoughts in their mind that things have already gone wrong, this could get worse. So people who have had a rough transition, who have not had a smooth transition, these are the kinds of people who are vulnerable.
I also feel that teenagers, I think they also probably must be going through a lot of stress, because not only are their bodies going through hormonal changes and things like that, but then coming in a new environment, and with the peer pressure being so much, and trying to make friends and all that, I think that demographic population is also quite, they are very likely to get more stressed and have mental health issues. I mean, from whatever I've read so far.
Yes. I mean, teenagers have a lot of expectations as well, that, many of their parents will have, usually they may not have started earning by that age. I'm not saying all of them would be like that, but they have that load or expectations that, parents have earned the money, and I'm here to do something, make my parents' money worth, and there is always this peer pressure of doing better than your others.
Correct. So, like in Canada, obviously they are the Citizenship and the Immigration Canada's website. They have a lot of services and resources for the newcomers to help them out, not only in all the things that you said, like day-to-day living, banking or financial, or even job search and things like that. So there are a lot of resources that people can actually go to and get help from. But could you probably tell us some of the best ways where newcomers can actually deal with the stress and anxiety after they come through the immigration process?
Right. So what I was saying earlier, we could specifically address each areas, starting with their initial preparation. So when the person is about to move in, it's the company or the organization or the whatever university should try their best to make the transition process smooth, whether it is visa or whether it is relocation, accommodation, and plan as much beforehand. So again, what I was saying about change. So if there is a predictability, the person knows that, okay, I have this such and such arrival date, I arrive here, then I go to this accommodation. Already he has seen the pictures of the accommodation, where it is, what kind of locality, how far is the my workplace, shops. So they have a picture, they have this predictability. So that process can start even before the person is actually in the country, in the new country. then of course there will be travel, especially with COVID. There are so many travel issues, quarantining or isolation, and you have to do your COVID test. That anyway, you have to follow government rules, whichever country has whatever rules, and which country they are coming from, whether what sort of a situation is there. But that clarity should be given, that again, so they know that when I land in such and such this place, after 2 days I have to have a COVID test, or after 8 days I have to have a COVID test, whatever it is. Then so this is all before the procedure itself, and then once the person is in the room, in the country, immediately that the organization should make contact with them. Basic things: have you reached properly? How are you? Is the accommodation to your liking? Is there anything that we can do? Basic these kind of basic things. And if it would be good to have some community support. Let's say people who have previously migrated, or whether recently migrated, they know the things very well. So recent migrants to that country can form a support network for the new person. And anybody, even people who are living in the country, can form a support network. It really doesn't matter, and help that person. Let's say he's quarantining. So how will he get groceries? How will he get supplies and those kinds of things?
Right.
So if each person, the organization, the community, people around him, every person does their bit, I think these problems can be addressed.
Right. No, thank you so much, Dr. Sujoy. Actually, this brings us to the close. But thank you for pointing these things out, because obviously your area of expertise is taking care of your mental health. But here we are talking about immigration, and how nicely you put the two together. And it's almost to the extent of, you can call it immigration counseling, that people who come new to the country, they should actually hear this out and help avoid the challenges and mental anxieties and issues that they might face. So I really am very thankful for all your tips, all your expert advice, and we really do hope that people are taking advantage of it. And we'll be coming back again next week with another episode. Thank you so much.
Thank you.
That wraps up this week's episode. Thank you to Dr. Sujoy for shedding some light on the mental health and well-being of newcomers and immigrants to Canada. Stay tuned, everyone, for next week's episode, the COVID-19 impact on mental health. If you enjoyed our video, give it a like and share it with your friends. Be sure to check out our other episodes in the series with the link in the description below. You won't be disappointed. Don't forget to subscribe to our channel and hit the notification bell button so you can be the first to know when our next episode is released. To stay in the loop, follow us on our social media at VSurf Canada. See you next week. Bye!